I want to thank Dr. Sundar for that helpful information, because I think all of us, one way or another, experience cough, whether it's after we eat or in the morning or whatever, and it's really helpful to know, one, it's important to keep that cough under control, and two, there are therapies that are available to treat it. Going on with the agenda, I'm next on that list, and it's about the legislative efforts. And there's a flyer. I hope that you all got one. There's a whole range of flyers back on that back table. Make sure before you leave that you pick up anything that is of particular interest to you. But this is the Senate Bill 1350 and the House of Representatives Bill 2505. And it's the Pulmonary Fibrosis Research Enhancement Act. And this is a very tough year to get any kind of bill passed. And anytime you're dealing with an election year, it's tough. But this is really crucial for funding research in trying to find a cure or at least some method of control of the idiopathic pulmonary fibrosis. So what I'm urging you to do is, one, read this, read the handout, and then get in touch with your senators and your House of Representative members. Write to them, call them, email them, but tell them this bill needs to be passed. And just this last year, we've had some experience. We formed a subcommittee here to try and find out how many IPF patients there were in the state of Utah. And it was stunning to me how little information there is, and it's virtually impossible to extract. There is a health directive that goes out every year and it's 5,000 people are randomly called by the Department of Health every year, and they go through a health questionnaire. There's nothing there on lungs except lung cancer. That's the size of it. So we thought it would be a good idea if we could get some questions added to that health survey about how many people had pulmonary fibrosis. They told us it would cost us $1,000 to put a question in. This is the state of Utah. Well, our little support group doesn't have $1,000 per question, and so that stymied us. Then we thought, well, we could talk to the oxygen providers. You all have to have a prescription, and we discovered that most doctors don't even bother putting down a diagnosis when they prescribe oxygen for their patients. They just put dyspnea, which just means shortness of breath. Doesn't tell you anything about what the underlying disease is. So in order to get research funds, we have to know how serious the problem is, and this will tell you exactly what this bill is asking for, and it's absolutely essential for progress to be made in helping find answers to this disease. So please read this and then call, write, email, whatever, your senators and your representatives and ask them to get on board with this bill. It has a very low dollar amount in it. It is by far the best bargain they could pass this year, but it's going to be probably fairly low on their priority list. But every voter counts this year. So this is a year you can have some impact. So give them a call. Any questions about the bill or that I can answer? Most of the information is on this handout, so please use it. Laura, you were going to talk about current studies in future meetings. And there is a sign-up sheet back there for anyone who is interested in signing up for a particular study, and Laura will tell you about that.
Currently, we have the Ascend trial, which is pirfenidone, that is open for enrollment. We have a stay on the other, it's called the Boehringer-Ingelheim study, which is another one. They've closed it in Europe, and so they said if they open up another slots, we should have a few more slots opening maybe in 2 weeks if they allow. They gave us priority, but unfortunately, after all the work that's been done, it looks like we may not be able to enroll in that study as we had hoped. But we do still have some openings in the Ascend trial, although it's difficult to qualify for that one. They're very particular, although they have recently decided to take a less stringent view of people's CT exams that they had before. When they had all the experts look at it, they took the most conservative views, and so they had knocked people out of the trial. So they're looking at some of those. So some people who may have been excluded may be included now. So we, unfortunately, with that premature closure for us of that BI, that we're hoping they'll reopen it, but we aren't sure. So the one, when she said to get some more information, if you want to just sign one of those forms back there about the Ascend trial, if you're interested in that, you can just speak to me afterwards. And we may be getting some more openings in our Fibrogen trial, but currently they're going back and forth, so I don't have anything concrete there. We're looking at some other newer phase 2 trials that may come, but they'll be very small, and maybe only 1 or 2 people would be involved in those. But always just stay in touch with us, and we'll try to find something and keep connected so that we can find something trial, because trials are the best way to go right now, where we don't have a definitive treatment for IPF. The other thing I wanted to tell you about is our next meeting. We've been meeting every other month, actually, and our next meeting will be in May, on May 17th. And Dr. Julia Kleinschmidt, she's from the Moran Eye Center. They had an article on her in their little flyer from Moran, and talked about how much she has helped people who've been found to be suddenly blind. And she has a presentation that she does on resilience and how you can, when something unexpected or shocking or disturbing happens in your life, how the coping mechanisms that will increase the quality of your life. And she has made a name for herself throughout the country in helping people deal with resilience issues. And certainly when you have a diagnosis of IPF, that's a shock to your lifestyle and your family. And she has a lot of good coping mechanisms, and just a very positive outlook, and talking about lifestyle and things that you can do. So I really think you would enjoy hearing her speak, and she's very highly thought of by the Moran people and people who've been recently diagnosed as with blindness, and she's their patient support services doctor over at Moran Eye Center, and internationally famous. So we'll look forward to having her come in May, and then we will have a break until August, and August 17th, and then October. And then if you have some interest, on the yellow golden rod form on the back table, you can list down topics that might interest you, that if you'd like to hear, if you know a speaker that you think would be excellent for our group or informative in any way, please call or write down or tell us. Or if you yourself have a presentation that you'd like to make and feel like you could have something that you could offer the group, we'd be more than happy to hear from you and appreciate any information that you can offer us in any way. So, any questions about all of that, or ideas that you want to bring up for our future meetings? Anybody? So think about it, and again, I think most of you have our contact information pretty readily available. Just give us a call, and we'll try and help in whatever way we can. Go back and get some more food. There's plenty of food back there. And yes, Audrey, yes, I'm glad you.
Just remind you guys to keep watch on the website. It's utah.lunghealth.org. And there's tabs on the left side. If you click on related links, I've recorded, I think, the past 4 meetings. So this is either the 4th or 5th, but they're all available to view on there. So you can tell, your friends, if they weren't able to make it, that they can still watch that and get the information from it.
Yeah, we had quite a few people who called and weren't able to make it, and they said, "Are you going to record it?" So again, utah.lunghealth.org.
Utah
Lung Health.
Health, okay.
All one word?
All one word.
Small?
Yep.
Utah Lung Health.
Yep.
Got it.
No spaces.
So, okay, well, nothing else, just feel free to mingle and stay as long as you like, and again, help yourself to take some food home with you. Thank you.